Hi there, I'm Jen Redfern from Plus Health Company, and I'd like to chat to you today about why you might still have knee pain following your total knee replacement or your uni knee replacement. That's when they replace part of the tibiofemoral joint rather than the whole of it. The likelihood is that you had significant arthritis which led you to require replacement surgery, and no doubt you had problems for some time before your surgery. So when your knee is causing you problems functionally and in terms of pain and discomfort, that can lead you to be generally less active over an extended period of time. So it's not just the knee that starts to become weaker as a consequence, but the body as a whole. And you may find that your body just became generally deconditioned as a consequence of being unable to be more active. So the first thing to do is to think about your current level of fitness and how you're exercising, and whether you feel like you have sufficiently compensated for the time that you were less active and strengthened all the muscles that surround the knee, through the leg, and on a wider level through the torso and up to the upper body as well. So really you need to be doing a full body workout to ensure that your knee is not compensating or having to work harder as a consequence of being weaker elsewhere. So it's almost like an indirect effect. So sometimes being particularly weak around the pelvis, so the gluteal muscles, that can be a really key factor, and that has a massive influence on the alignment of your legs as well. So if your buttocks are not strong, folks, then actually you need to start there as a means of helping to improve your lower limb alignment. Having good, strong feet is also important. So having somebody check out your foot posture if you don't know whether you may be pronated or supinated, and doing some little foot exercises, some balance control work, but possibly looking at orthotics or perhaps just a better footwear, so that can really enhance your position as well. Because how your feet contact the ground influences the knee, given that it's the next joint up. But if you've had your tibiofemoral joint replaced, then what has been replaced is that main joint in the knee. And it doesn't necessarily mean that the kneecap joint, the patellofemoral joint, has been replaced. So if you have got problems with prolonged sitting, so for instance, if you were to go to the cinema or watch a movie at home or go to the theatre, if you find that going upstairs or downstairs is problematic, and if you feel that there is almost like a clicking or a grating sensation still within the knee itself, then it could be that the kneecap, as it's moving in the little groove of the joint behind, is actually got some degenerative change as well. So having osteoarthritis on the undersurface of your kneecap is called patellofemoral arthritis, and that can still give you pain around your knee after joint replacement surgery. Now, another factor, of course, is being strong around the knee itself, and this is a really key part. So if you don't have adequate stability, control, strength and endurance in your quadriceps muscles, through your hamstrings, through your calf in particular, then we're going to have a potential issue with regards to stability of the knee as a whole. And conversely, if you have tightness in the muscles that surround your knee, so primarily your quadriceps, hamstrings and calf muscles, then that can also lead to a change of distribution of work around the knee, and itself can change the biomechanics, particularly for the kneecap joint. So overall, you need to make sure that your body is strong as a whole, so that the knee is not having to suffer for weaknesses elsewhere, that you have adequate stability around the knee joint itself, that you've considered whether the kneecap is an issue, whether it be in terms of tracking or arthritis symptoms, and whether you're wearing good shoes and if you need support within those shoes to enhance your foot posture. So hopefully that gives you a few ideas, some starting points in order to progress. If you need any further advice, we'd be more than happy to help you. We're based in West Yorkshire, but of course we can meet you remotely wherever you are in the world if you wanted to look at an audiovisual consultation with us. So hopefully we'll hear from you soon if you need our support, but otherwise take care and good luck getting better.